orthopedic massage for shoulder, arm, and hand conditions. What I use is a shea butter, and these are the cubes that I showed you that I made back in the aromatherapy class. So it provides enough to where it gives enough drag on the skin. Another thing that you need to keep in mind are your mechanics when you are doing this work, and you also, to make it just a little bit more effortless, if that makes sense, you want to have your table as low as you possibly can so that it doesn't sacrifice your mechanics. So I'm going to divide it 3 separate ways. We're going to start with the biceps, triceps, brachialis muscle here, and then I'm going to show you how to work the deltoids and the triceps in the sideline position. And then I'm also going to show you how to do the forearm work and the hand work. So if this is not a deep tissue massage and you're just focusing on the area of concern, you're going to need a little bit more room. So I'm going to ask my client just to scoot over just a little bit to the right so that I have, so there we go. And let me just make sure. Yep, that's looking good. The majority of your work is either going to be with your proximal knuckles or your distal knuckles or a braced finger, okay? Everything is a sync, so you're not going to just jam your client with deep tissue work. You're always going to ease into it. So remember, as far as firmness is concerned, I'll come down here. This is 1, this is 2, this is 3, this is 4, and then again, with my body mechanics and just sinking in, this should be about a 5, all right? So you want to just, when you do this work and you want to get that depth, you need to sink into it as opposed to going straight into it. So I'm going to start up here with my separation first, and then my lengthening, and then I will use a braced finger, and I will braced fingers, and I will go back and I will clean this up. So both hands, opposite side. It's like that compressive broadening that I have shown you way back when previously. So sink, and I also want you to notice how slow I'm going. So you're finding that division here with your body mechanics. You're sinking in slowly and you are separating. Sink in slowly and separate. Now for the biceps, I can actually bring the arm out, and I'm gonna hold it right there because I just want to make sure that I got it. Yep, I do. Okay. And then when I'm facing my client this way, this hand does the work here, this hand does the work here. So again, so I'm actually supporting it with one hand, but I can actually sit down. And so if I'm sitting down, I can actually have the client's arm rest up against my knee. But just for the purposes of this, because I can't get a chair here, I'm just going to stand, support the hand, support the arm with one hand, and with the other, I'm going to slowly sink into this bicep and brachialis. If that's too much, you let me know. And you see how slow I'm going up towards its insertion. Communicate with your client if it's too much.
Here.
Okay, I'm letting up just a little bit. All right. Yeah, that's where you're having your problems right there. I can feel it. So I'm gonna lighten up just a little bit. Okay, so he's having problems, and this is also part of the pec muscle, and I'm going to show you how to address that in a minute. But I am going to get the inside, so I'm going to stop here. I'm going to come around, and then support, sink, and you're going to take it almost all the way up into the armpit until it stops you. Now, you got the feeling back in your arm?
Yeah.
Sorry. So now I know that he's got a lot going on in here. So what I'm going to do is I'm going to kind of come back. And if you feel like these lumps and bumps, so that is like a lot of adhesive buildup that's within that muscle tissue. So I'm just going to come in with a brace finger and I'm just going to clean this up. And I'm gonna hit you in the pec in a minute. Just checking to see, I'm assessing the tissue and see if there's other areas that can be kind of cleaned up, and I find some bunched up tissue here. All right, and I'm gonna stop there. So one of the things that I noticed as I was working the arm, that his pec muscle tissue here is tight and contracted. So we need to address the pec muscle here. You're not going to be hitting down here. You're going to be starting here by part of its origin, which we will learn as we go along, all the way out to the insertion. So I'm going to come over on this side, and with my knuckles, I'm going to start at the sternum, and then I'm again sinking in, and then coming just straight out, just almost following his collarbone. If I need to do it more than once, I will do it more than once. So it's almost like you're scooping up the tissue in your knuckles, and then you're bringing it out and you're bringing some length to it. Bringing the arm up overhead just a little bit, as far as you can go. That's fine. And then I'm going to come back this way, because you see all this is his pec. So again, I'm going to start here towards the insertion, and I'm actually going to go back the other way. So can you see the redness? Do you remember what that's called? Hopefully you do. Then with my fingers, because I feel just a little bit going on here, so I'm just going to come with my brace finger and I'm going to clean that up. So I'm going to switch up. And you don't have to use these fingers, you can use your thumbs as well. And again, don't jam your client, because I know that he's in pain. Yeah. That's it, right?
Yeah.
There. That's it.
I know, it's
Okay. Okay. Tell me how that feels so far. We need to throw some ice on it? Okay. Dimmer, okay. All right, so we're coming up on 12 minutes. I don't know if I'm gonna have time to show you how to do the triceps, but let me see what I can do. I'm gonna stop it and have him lay on his side.